In this video, we will discuss shared decision making. We will talk through how and why to share information and decisions with your patient, involving them in their care and giving them options. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. In recent years, the benefits of shared decision making, negotiation and mutual collaboration in consultations, in other words, fully involving patients in their care, have become clear. There are many benefits to shared decision making. We know that 50% of all medicines aren't taken as intended by most patients. And this can be a result of many reasons, which leads to lots of health complications. We also know that when decision making is negotiated and the patient is fully involved, that adherence to treatments or medication regimes are improved, and hence so are health outcomes. Shared decision making also improves patient satisfaction, as patients are more likely to feel they have been listened to and their views genuinely considered. In 1979, a study by Eisenthal et al. Demonstrated that negotiation and patient participation increased adherence and led to greater satisfaction. By 1980, Brodie suggested 4 steps that are necessary to encourage the patients to have an active role in decision making. Those 4 steps are: 1. The practitioner should establish an atmosphere that is conducive to participation, where contributions are welcome and the patient's ideas and questions are actively sought. This encompasses the skills involved in rapport building so that patients are comfortable and trust you. Secondly, the practitioner should ascertain the patient's reasons for attending the consultation today, trying to find out their goals and expectations. This closely relates to ICE, ideas, concerns and expectations. Thirdly, the practitioner should give appropriate information about the nature of the problem, including the practitioner's rationale, possible alternatives, and each of the advantages and disadvantages of all of those recommendations. This will allow the patient to make an informed decision and to understand why you may have made certain recommendations. Finally, the practitioner should elicit the patient's suggestions and preferences and negotiate on any disagreements. The correct decision is influenced by the values that a person attaches to certain outcomes. In other words, different things will be important to different people. Having a shared decision-making approach to your consultations is the best way to ensure that patients are empowered and involved in their care. The practitioner and the patient should share all stages of the decision-making process in a shared decision-making model. There should be a two-way exchange of information. This includes a lot of different types of information, and they are all important, such as clinical information that the practitioner has, the expert information that the patient has about their condition, as well as their ideas, concerns and expectations. The patient should also be able to share their preferences, and the practitioner explain their recommendations. Based on both of these viewpoints and all the information being shared, a decision should be agreed upon together. It's worth noting that it's okay for a practitioner to have a preference based on their clinical experience and knowledge, but you must also communicate to the patient that their preference is equally as important and that a consensus can be met together. If the practitioner makes a recommendation, the patient should always understand the rationale for that. On the flip side, the practitioner might not have a preference at all and just present the patient with options. Either way, the practitioner should not ever disapprove of an option that a patient chooses. A discussion is very important. Let's say, for example, a patient tells you that they are managing their condition with alternative therapies, and you know that there isn't any hard evidence for their efficacy. You should not shoot the patient down and condemn their decision. Instead, you should say something like, how did you come to decide on that route? You should be non-judgmental and initiate a discussion about the patient's reasons for their choice. If you convey that you disapprove of a patient's choice, you could damage the relationship, and it can be difficult to improve on that later in the consultation. It may leave the patient feeling patronised, and they're much less likely to enter into a mutual, collaborative discussion. Offering the patient choices as opposed to directives is an integral part of shared decision making. You should outline the options available, explain the advantages and disadvantages, and let the patient decide on what is more preferable to them. If a patient has already discussed their preferences or values, then you can work up presenting different options to them. However, some patients may not want to make these decisions, or may say things like, I don't really mind, what do you recommend? In which case, it's more suitable to suggest the option that you think is best for the patient, but it is still very important to check that the patient is happy with that choice. In summary, when you come to share a decision, you need to present all the potential options to the patient, their strengths and their weaknesses. The patient can then make an informed choice about what would be their preferred option. This is likely to result in better adherence to the recommendations and, ultimately, better health outcomes. Thank you for watching Consultations for Health. Don't forget to like our Facebook page, follow us on Twitter, and subscribe to this channel.